One of the first things that I think about in these situations is to remember that not every patient who develops urinary symptoms after egg retrieval actually has a urinary tract infection. And I think this is for us in that urology world, we like the confirmation. So people will have very similar symptoms because there are several physiologic changes during that procedure that can create those same bladder symptoms. Right, so mechanically, the ovaries become significantly enlarged during stimulation. They are sitting immediately adjacent to the bladder. So patients often experience urinary frequency, some urgency, maybe even some pelvic pressure. Also, they could feel a sensation of incomplete emptying simply just from this enlargement of those ovaries. During the retrieval, a transvaginal needle passes very close to that bladder. And although a bladder injury is very uncommon, just simply having instrumentation near that area can cause tissue inflammation, which is temporarily irritating those surrounding structures. Plus, they have anesthesia and IV fluids, and there could be some temporary urinary retention that follows with that, or constipation, or pelvic floor guarding that commonly occurs afterwards. So there's multiple reasons a patient may call a office with urinary complaints. And from a counseling standpoint, I encourage clinicians to prepare those patients. Right. Everybody wants to know ahead of time what's going on or what to expect. And sometimes we forget that urinary symptoms may actually happen. So letting the patient know that there could be some mild frequency or some pressure for a few days afterwards is very common and very normal. But if there is burning with urination, fever, flank pain, right, inability to empty out that bladder, blood in the urine that you're visually seeing, or progressively worsening pain, those are things that deserve prompt evaluation. And then rather just automatically prescribing antibiotics, I want a urinalysis, I want a urine culture when appropriate, because right, we don't want to miss an infection if it's there, but we also don't want to treat something that may mimic it, like the pelvic floor dysfunction or even that post-operative inflammation with unnecessary antibiotics.